Hello, so our project is on the loop electrosurgical excision procedure, also known as the LEEP. Some things about this procedure is that it uses a wire loop heated by electric current to remove cells and tissues in a woman's lower genital tract. It is used as a part of the diagnosis and treatment for abnormal or cancerous conditions. The lower genital tract includes the cervix and vagina. The vagina is the lower narrow part of the uterus, and the vagina connects the cervix and the uvula. With the LEEP process, an electric current passes through the fine wire loop for abnormal tissues. This tissue will be sent to the lab for testing, and it's a cell to allow healthy tissues to grow. The procedure steps for this procedure is number 1, to assemble the necessary equipment, number 2, to sanitize your hands, number 3, to greet your patient, introduce yourself, and verify that the patient is the right person, and to record the patient's vital signs. Check to make sure that they signed a consent form that is in the patient's records. Number 4 is to drape the patient and assist her in the lithotomy position, which then you will put your gloves on. Number 5 would be to assist with the procedure by handling the provider, the equipment, and supplies as needed. The LEEP instrument is used to remove abnormal cells. And then number 6 would be to encourage the patient to take deep breaths to promote relaxation of the pelvic muscles during the procedure. And then you also would have to observe the patient for any signs of distress. Number 7 would be to, if there's a biopsy is taken, then you place the tissue in a specimen cup and label it for the laboratory. Number 8 is when the procedure is done, you'll have to put the patient in a supine position and allow her to rest while you tidy the room. Number 9 is to remove your gloves and discard them in the biohazard waste, and then also sanitize your hands. Next, you would do to help the patient is to sit up and assist her in dressing if they need help with it. Then you will apply gloves and prepare the specimen for the lab. And then you will sanitize, disinfect, and sterilize the equipment and return it to the area. And then you would remove your gloves and sanitize and follow up as ordered by the provider. And then the last step would be to document and record the procedure and get the last final vital signs that you would take for the patient's records. What you could expect during this procedure is that the patient is placed in a standard position, and the speculum is used with a colposcope to visualize the area. The cervical is prepared with acetic acid and iodine solution to allow for identification of the lesion. Using a thin or electrical heated loop wire, the doctor carefully excises the lesion while cauterizing to prevent any further bleeding. The purpose of this procedure is that it can be used to assist in diagnosis or treatment of the following conditions, which are like polyps, genital warts, and deaths that are like exposed in women whose mothers took deaths during pregnancy, and it has like a increased risk of cancer of the reproductive system. The equipment and supplies are the colposcope, the LEEP instrument, the vaginal speculum, local anesthetic with syringe unit, and the muscle solution or similar solution to prevent cervical bleeding. Other equipment and supplies include disposable gloves, specimen containers, biohazard containers, cytological request forms, and the patient's health record. As a medical assistant, you would have to help by explaining the treatment procedure to the patient. You would have to drape the patient and assist them in the lithotomy position. You would have to handle surgical equipment to doctors, and you would have to assist the physician by handling them the surgical tools they need. Why a patient might need this procedure is because after a pap smear or a biopsy confirms that you have abnormal cells in your cervical, then they would have to recommend this LEEP procedure for you to do, and this procedure is used to diagnose and treat cervical dysplasia and conditions like genital warts. Before the surgery, we would assist the patient to not use tampons, vaginal creams, or medicine, touching or having sex before the procedure, because it's recommended to be done when you're not on your period, and they would recommend you to take a pain reliever 30 minutes before the procedure. After this surgery, patients may feel lightheaded, which will have them take a rest for less than 30 minutes. But the recommended is to not have an intercourse for 1 to 2 weeks. Patients can return to work or school 1 or 2 days after the procedure, and then the patient will need to go see a OBGYN for follow-up visits. If the patient has another abnormal test result, then they may need another treatment. This is the Q&A. The question is, how painful is the LEEP procedure? Some risks of having this LEEP procedure is that there is a small possibility of heavy bleeding or an infection, and then you would have to contact your healthcare provider immediately if you notice anything. After a LEEP procedure, you should not use tampons for at least 3 weeks. You can use pads or panty liners. You shouldn't be having vaginal sex or put anything in your vagina, like fingers or your sex toys, for 3 weeks unless your doctor or nurse tells you otherwise. And then this is a video of the LEEP procedure.